Hello.
I think Sakib, if Farjana is ready, then you can start the introduction.
Okay, should we start?
আমি তাহলে
I think
সাকিব
If Farjana is ready, then you can start the introduction.
একটু ওয়েট করো ওই
Okay, should we start?
আমি তাহলে
I think
সাকিব
If Farjana is ready, then you can start the introduction.
একটু ওয়েট করো ওই
Okay, should we start?
আমি তাহলে
I think
সাকিব
If Farjana is ready, then you can start the introduction.
একটু ওয়েট করো ওই
Okay, should we start?
আমি তাহলে সাকিব
If Farjana is ready, then you can start the introduction.
একটু ওয়েট করো ওই
Okay, should we start?
আমি তাহলে সাকিব একটু ওয়েট করো ওই আমি তাহলে
I think echo হচ্ছে।
হচ্ছে ওয়েট করো ওই আমি তাহলে
I think echo হচ্ছে।
হচ্ছে ওয়েট করো ওই
I think echo হচ্ছে।
হচ্ছে
আমি রিকোয়েস্ট করছি কাইন্ডলি সবাইকে একটু মিউট করার জন্য প্লিজ।
হচ্ছে
রিকোয়েস্ট করছি কাইন্ডলি সবাইকে একটু মিউট করার জন্য প্লিজ।
হচ্ছে
রিকোয়েস্ট করছি কাইন্ডলি সবাইকে একটু মিউট করার জন্য প্লিজ। রিকোয়েস্ট করছি কাইন্ডলি সবাইকে একটু মিউট করার জন্য প্লিজ। রিকোয়েস্ট করছি কাইন্ডলি সবাইকে একটু মিউট করার জন্য প্লিজ। রিকোয়েস্ট করছি সবাইকে একটু মিউট করার জন্য।
Okay, we are fine. Yeah.
ওকে, মামুন ভাই স্টার্ট করবো?
আচ্ছা আমি শুরু করে দেই তারপরে তুমি যেতে যেও হ্যাঁ okay so it's good afternoon everyone, this is Dr. Mamun, General Secretary, Bangladesh Medical Association North America. We have another ERAS session. We have new batch of young doctors, and as for last couple of years the BMNA is helping to organize couple of sessions that could be very helpful for the young physician. Before going to the main program, I will invite our new president, Dr. Bashir Ahmed, for his opening remarks. Dr. Bashir Ahmed. Bashir?
Yeah, thank you. I didn't realize that I didn't unmute. So thank you again for doing such an excellent program. And I'd like to thank Sakib Hassan, our Young Physician Secretary, and Dr. Farzana Haq, our speaker for today's session, and also all of our aspiring physicians who are waiting to get into the training program. So Bangladesh Medical Association of North America, we have been doing this program for several years. And I hope, we are going to continue to do all these activities that will help our young physician to get into our training programs. And without further delay, I would request Dr. Sakib Hassan to give the introduction to our speaker and start our session today. Thank you for joining.
Hi, good afternoon. Thank you everyone for joining this session today. I'm Sakib Hassan. I'm very glad to invite Dr. Farzana Haq for our first session today. Our first session is ERAS application, what we need to know. And our speaker is Dr. Farzana Haq. I'm very honored to introduce Dr. Farzana Haq, who is an associate professor of medicine and internship co-director in St. Louis University School of Medicine. She's also the president, Society of Hospital Medicine in St. Louis chapter. Dr. Farzana is an eloquent speaker, educator, an excellent leader, and advocate for our young physician. So I will move the mic to Dr. Farzana. Dr. Farzana.
Thank you so much, Dr. Sakib Hassan. That's very kind of you, and I'm so much privileged to be invited here today. First of all, I would like to extend my warm congratulations to the new leadership of BMNA. And I always enjoy talking to our aspiring young physicians. So thank you so much all for joining today. So when I first, if I remember, when I was preparing for my ERAS application, the experience still gives me goosebumps because I was in a situation I really did not know where to start. So over the years, after applying, then doing residency, from giving this talk, talking to multiple American graduates, international medical graduates, I have learned a couple of tips and strategies, which I would like to share with you, hoping that it will be truly valuable for preparing your ERAS application, and you will stand out from the pools of other applicants. So first, what is ERAS? ERAS stands for Electronic Residency Application Service. So why we are here today? Why all of us are taking so much time to talk about it? Because ERAS application, it's truly representing you. The program do not know how brilliant you are, what are your scores, how much hardship you overcome. Your ERAS application is truly representing you. So I say that use it or lose it, because ERAS application is critical to get interviews as well as make a strong impression. Disclosure, I'm not a professional resume writer. And also, I will highlight a couple of valuable resources, couple of organizations you can be involved, mentioned in your ERAS application. I do not have any financial relationships, all those mentioned organizations. So very important to remember that you cannot apply to programs until your application has been certified and submitted. In addition, remember that once you have submitted your ERAS application, you cannot make any changes. So take your time, make sure this is flawless, because if there is any mistakes for the rest of the interview season, matching season, once you have submitted, you cannot make any changes. So let's see what will be the outline of this session. First, we will go over a step-by-step approach to create outstanding ERAS application. I will talk about a couple of important points that you can utilize easily while writing and reviewing your personal statement. Thirdly, how to obtain excellent letter of recommendations. And finally, I will share with you a couple of key takeaways, believing that you will be able to use it to make your ERAS application outstanding and flawless. And I have reviewed all the new changes of 2024 ERAS application for this talk, and I will highlight all the new changes because I want your time to be utilized, and I want that you are aware of those new changes so that you can utilize them to your best advantage. So first, it starts with your name and present mailing address. Make sure that the name which you are including, that is matching your ID. For example, your driving license, your green card. Because I'm mentioning it specifically because those who are from Bangladesh, India, most of the time, we have the middle name. So if your middle name is in the ID, make sure to include it. If it is not, no. So rule of thumb is your name should match with your ID. Secondly, previously, truly US address was preferable because they were looking for people who can come to the interview very shortly, because those people who are in the US, they can come to interview with any cancellation very shortly. The situation has been changed because now most of the interviews are virtual. However, I will still recommend you to use a maybe mailing address which is in US. And do not use PO box. I would like to spend a couple of moments regarding the email address, because make sure that you are using separate email address for your ERAS application. During this season, you will get so many emails. If you do not have separate email address, you will waste so much time to find out the email, to sort out the email. Do not take that chance. Use a separate email address for ERAS application. Very important to remember, use professional email address. What do I mean by that? Sometimes people are very creative. They use very fancy email address. ERAS is looking for professionals. Creativity in terms of email address, not a good idea. Also very short. For example, my name is Farzana Haq. If I put fh@gmail.com, it do not sound very professional. So what you can do about it? You can use simply your first name and last name and create the email address. Because I believe that sounds more professional and you are giving signal about your name as well. So I will highly recommend you to use professional email address and create a separate email address solely for the ERAS application. There are some additional information will be in the ERAS application. And what I'm doing, I'm going through exactly at the real application sequence so that it will be easier for you to follow as well as easy to remember. So the next part is coming additional information. They will ask about Six Sigma, Alpha Omega Alpha, Gold Humanism. Truly do not worry about it. Almost 99% of the IMG, they do not have any of this status, and US schools know it very well. So skip it, do not sweat about it. Then come languages. Be honest, because I am doing this faculty interview for now 6 years, and sometimes it happened that candidate claimed that he is proficient in some language. So when I'm Googling that language and trying to start the interview, maybe how are you with that language, it does not go very far. So be honest and mark that, okay, how much the proficiency of your language. And personally, I believe that knowing multiple language is truly a strength. For example, if you are doing residency in New York, knowing Bengali, Hindi is an asset. If you are doing residency in Florida, knowing Spanish is an asset. So use it. And important point to remember that sometimes it could be one of the common ground to start the interview. So the next part is geographic preferences. This is a very brand new section of ERAS 2024 application. So through these geographic preferences, they are trying to find out that candidates are interested in which area. For example, are you interested in Mid-Atlantic region? Are you interested in Eastern area? So what they will do, if you choose a particular area, the program directors of those areas programs will get the signal that, okay, this candidate is interested in that area. If you are selecting, I do not have any division preferences, then all the programs will not get any notification. So if you are choosing a particular area in the US, this is a great opportunity to give the signal to the program directors. Next part is medical education. And we all know that year of graduation is absolutely important. The reality is we cannot change it. It's like our age. We just cannot change it. So we all know that 5 years of graduation is preferable. For some programs, it even 3 years. However, there are many candidates who have matched and will match their graduation year is more than 5 years. So if you are one of them, which are the things you can do to beat the competition? First, strive for high USMLE scores. I know that right now USMLE 1 is pass and fail. However, there is a step 2 CK and a step 3. Hands-on clinical experiences. I work in a university hospital. I understand that it's not very easy to work in a university hospital, either in observership or externship for an IMG. At the same time, we all know that programs are looking for hands-on experiences. Thirdly, research. It could be paid or as volunteer. Publications, good letter of recommendations. So the next section in the ERAS application is postgraduate training. For us who are from different countries like Bangladesh, India, China, I know that some of our participants who are also here besides Bangladesh and India. So if you have any training, postgraduate training in your country, this is the great place to highlight it. Some of the candidates, when I was counseling them, they told me that they feel ashamed to put it because it shows that, okay, they are old, their year of graduation is more. However, I do not agree with that, because if you have postgraduate training, it shows that you have more experience, you have more hands-on experience, you have more experience talking to patients and their families. So I will highly recommend you to use the opportunity to showcase your postgraduate training. It could be a fellowship training, it could be MD, it could be MRCP. The next part is membership. And the organizations which I am highlighting here, like American College of Physicians, AMA, the good news is that their student membership is free. So use this opportunity to be member of them, put it in your ERAS application, as well as utilize of their free resources. They have a lot of resources for interview preparation, for ERAS application, how to write thank you email. So look through those. Those are very helpful. And also, there are a couple of other wonderful organizations of Bangladesh, India. If you are a member of them, include it. The membership does not have to be always the US organizations. Then the next section of 2024 ERAS application is medical school awards. So focus your medical school award. If you have any award, highlight it. One key point here I would like you to remember that just do not tell, okay, I was best intern, I got this best resident. Give them context. For example, okay, if you are the best intern, how many interns were there? Or like, what are the things truly they look for? Were you voted by faculty? Were you voted by your peers? Were you voted by the nurses, or all of that? So rule of thumb is give them context of this award, not only mention the name of the award. And this truly require planning because there is limited characteristics in this section. So give context, however, keep it concise. So the next section is other awards. Be mindful not to include all of your awards from high school. Truly, nobody wants to go back that much far unless that is extremely significant. For example, maybe when you were in the school, you got a national championship through sports. Yeah, include that, but not very a small thing and not from 20 years ago. And showcase the awards that shows your enthusiasm, your cultural minds, because when they are evaluating your ERAS application, they are not just looking for a scores, a robotic physician. They want a person who is a good team member, who has adaptability, who has creativity. Because all of us, we are looking for this star. So they are looking for somebody who has other extracurricular achievements as well. The next section is selected experiences. And here I would like to highlight that there is a big change of this section in this ERAS application. So previously what happened, they had like unlimited experiences. For example, when I gave experiences, there was no number, and there was no number until last year. So this year, they made big changes that you can only include 10 experiences. And among those 10 experiences, you have to highlight 3 most meaningful experiences. And I have to emphasize that experiences area is one of the most important sections of your ERAS application. That can give you the interview or can put your application in the rejection folder. So make best utilization of this section. So more about selected experiences. So in the selected experiences, they will have a couple of options. First is work. You can show clinical work, teaching. Then is volunteer. It could be because it's volunteer, so that means it's unpaid. Not all the volunteers have to be hospital or healthcare related. It could be other extracurricular as well. But be mindful because you have only 10 options. There is also another option called research. And if it is paid, include this section at work area. One important point I would like to emphasize here that personally, it could be different choice for you. But personally, when I was preparing my ERAS application, I include my clinical activities under the work section. So more about selected experiences, because this is a very important section. So we all know that hands-on experiences, externship is very important, and that goes a long way because it increases your credibility. Imagine yourself that you are the program director, because after some years, you could be the program director. Imagine yourself in that shoe. And if you are hiring a candidate who is coming from another country, you would want somebody who has hands-on experience, because as soon as that candidate is the intern has to take care of the patient, need to know the basic of the system. So if there is hands-on experience, that always put your application at the higher level, because that increases your credibility. Then is observership. If there is nothing, observership goes a long way. So make sure you are having experiences in the US healthcare settings. And again, I have to acknowledge that it is not easy. When I was looking for it, I do not know how many rejections I got. So it's not always very easy, but this is very important. Particularly COVID truly make things very, very difficult because hospitals are still not very much open like before. So for experience, description is vital. So the main point is, what did you learn? And also, which skill did you develop? I will include a couple of skills that you can utilize in your application. First, case presentation. When you are an intern, every day you have to present at least 8 to 10 cases. So if you are doing observership or externship, learning the case presentation, this is always a good point to include in the experience description. Then electronic medical record. There are a couple of electronic medical record, right? Epic, Cerner. Even if you are not writing the note, you do not have to. If you are seeing that, okay, how they are making a template, how they are documenting, that goes a long way. Then clinical knowledge through didactics. And didactics, when I was first preparing for my ERAS, I had no idea that, okay, what is that? So then didactic means because every residency program, they have their morning report, noon conferences, grand rounds. If you are joining these educational sessions, That means you are already getting familiarized yourself that, okay, as an intern, as resident, I have to do these sessions. So include those. If you are joining any morning report, noon conferences, include that in the description. Then time management. Time is the most valuable asset in this world. And I'm telling you, including me, all of us wish that, okay, we could have better time management. So this could be one of the skill you can include in the description. Then teamwork. So teamwork with the faculty, with attending physician, teamwork with your co-interns, co-residents. Also, because this is very different than the medical system of Bangladesh or India. For example, physical therapy, occupational therapy, social worker. So if you are saying that, okay, how an intern, a resident is managing a patient, talking with the social worker, physical therapy, occupational therapy, that is also a good point to include a couple of your experience description. And then patient counseling. You know, in medicine, we are giving so many bad news, and that is a skill as well as art. So if you are not, maybe if you do not have to do it by yourself in the US, if you are, you know, applying for the residency position. However, if you are observing that, okay, how a intern or resident is doing, how a attending physician is doing, you can include that you have learned how to do the patient counseling, how to give a bad news, how to talk about the prognosis. Very important point to remember that when you are writing these descriptions, always use active verbs, because active verbs give the power to your writing. So some examples of active verbs are perform, conduct, manage, coordinate. You know, nowadays, if somebody wants to learn, nobody gonna stop that person. Just Google list of active verbs. You will get a lot of active verbs. Use them to increase the power of your writing in the ERAS application description box. Couple of important points I would like to highlight about the experience: that do not keep your description box blank. Believe it or not, it happened, because when as an interviewer, I am interviewing people, before that I'm reviewing their ERAS application. Sometimes the box is empty. So make sure you are not one of them. Secondly, be clear and concise. Truly, for this year, this is more important than before, because now the characteristics are much more limited than before. So be clear and concise, very much to the point, what message you want to convey. And thirdly, this is my personal opinion, I prefer bullet points. So if you are doing bullet points, do 3 to 5. If you are a person that, okay, you are better in writing in paragraph, do so. Because in ERAS application, there is no right or wrong way. However, there is always a way to do better and then eventually best. So the next section of ERAS application 2024 is meaningful experiences. And this is a very, very new changes for this year. So you have already mentioned 10 experiences, and that 10 experiences can include your clinical, teaching, research, volunteer. I will recommend to mix it up a little bit, not maybe all the clinical, not maybe all the research. Majority have clinical, then some research if you have, then maybe 1 or 2 volunteer. So if you arrange it this way, there will be some variation in your experiences, which is always desirable. Then among those 10, you will highlight 3 meaningful experiences. So do not only write down what did you do, because if you read the headline, they are asking for specifically why the experience is meaningful. So meaning that you have to highlight that, okay, why these experiences what taught you, why do you think that among those 10 experiences, these 3 are meaningful? Then the next section, which is also brand new for this year, that is impactful experiences. And truly, I found this section very insightful, and I wish I could have this section when I was applying for my residency. Because I believe as an IMG, we have overcome so much hardships. So this is a great opportunity for you to showcase that, okay, what challenges did you overcome and which things you have learned, and those lessons, those skills, certainly you will be able to use during your residency. So this is a screenshot from that section. As you can see, they're asking, okay, are you a first generation, or did you have any financial challenges? Are you from marginalized population? Are you from the society who has limited educational opportunity, or God forbid, any loss of any family members? So if you have any challenges, experiences, highlight that. And I will recommend you not only highlight your challenges, most important thing they are looking for, what those challenges taught you, what those challenges made you better than before. So then next section is presentations. The presentation they are mainly looking for at conferences. It does not have to be huge conferences. For example, if you have research day at your medical school, if you are doing any regional, I know that BAMNA had conferences this year, and there were a lot of wonderful posters this year. So if you are doing any conferences, include that. And the presentation can be divided into 2 main categories. One is, as you can see in the first picture, is like poster presentation. And then second, in the second picture, as you can see, it's oral presentation. Certainly, oral presentation carry more weight than poster presentation. However, at your stage, when I was applying for residency, I did not have that much oral presentation. So I had poster presentation. That's what I highlighted. Very important to remember, case presentation at rounds does not count as these presentations. In the next section, I would like to highlight here volunteer experiences. It does not have to be all medical related. For example, if you are working in a group that help the homeless people, you can include that. Community contribution. I believe community contribution is very, very important. And then teaching. And the teaching, if you are teaching in a medical school and got paid, that should be under the work experience. On the other hand, if you did teaching in any community setting, for example, maybe you taught and a very elderly section in a village, or very children, they just learn how to write from you, that will be under the volunteer experience. Mentoring. If you have done some mentoring, that's a great place to showcase that, because when you will be a resident, when they want that resident to be the mentor of that intern, even if you are an intern with God grace next year, they want to be the mentor of that medical student. So if you have any mentorship experiences, include that. Then hobbies. Some people will tell me that, no, I will not include any hobbies because it shows that I'm not very much focused in medicine. I do not agree with that, because remember, first of all, we are the human being. Second, we are physicians. So if you have some hobbies that give the signal that, okay, you are creative, you are, know how to utilize the time productively, include that. And remember, it could be a common topic for your interview, because when the interviewer is starting an interview, they want to do some ice-breaking questions. That means they want to start with something like very in the ground level, so that the interviewee feel very comfortable to talk to them. If you like to play video game, like to watch Netflix, I like to watch Netflix too. However, this is not the right place to include that. I still remember one candidate told me that she likes archery, and I forgot her credential, I forgot her many of the things, but I still remember her that interesting hobby. So if you have a creative hobby, include that, and that could be one of the deal breaker for the interview. This is another brand new section in the ERAS 2024 application, and that is program signals. So this is a great opportunity to express interest in a residency program. And if you go through the application, for every specialty, this signal is different. For example, as the ortho is very competitive, they can give signal to 30 programs. On the other hand, as most of the IMG apply for family medicine, internal medicine, pediatrics, for example, for internal medicine, it's around 7 programs. Rule of thumb is that know which programs you want to give signal. For example, if you have like 230 at CK, and if you are giving signal to program who takes candidates who has 260, it's truly not helping you. So if you remember, you have only very limited option to give signals to the programs. So use it very cautiously. See, okay, how many IMG they are taking, what are their graduation cutoff, what are their score cutoff. Then thoughtfully select those handful programs to give signal. Because if you are able to give signal to the right program, that can help you to bring the interview. And I found this new section truly thoughtful from ERAS side. This may sound very simple, spelling, grammar, punctuation, articles. Who think about that? However, if there is a small spelling or grammar or article mistakes, somehow our human brain can see other person's mistake very, very easily. And then what happens once you submit, and if there is any mistake, you cannot change it. That will truly bother you. So do not take it by chance. Be mindful, because ERAS application does not include any spell or grammar check. Always proofread. I cannot emphasize the importance of proofread. I truly cannot remember how many times I proofreaded my ERAS application. Then my husband proofreaded and his friends proofreaded. So this is very, very important. If you need, you can use a software to assist you with the grammar and spelling check. If you are not sure, always double check it. Truly Google it. Now Google is the best friend. You can use it to your best advantage. Capitalize cautiously. Do not use all caps. If you see this line, do you see how difficult and uncomfortable it is to read? So capitalize cautiously. The first letter of each line should be the capital. So remember, do not use all the capital. Then I would like to emphasize a couple of other important topics, then which is professional photo. It may sound very cliche that, okay, I do not need to think about the picture. However, believe it or not, this is giving a signal. This is your first impression to the program coordinator, to the program director when they are reviewing the application. So I will emphasize to have a professional headshot, and truly it requires planning. One important advice I would like to share with you, that when you are giving your CV to the letter of recommendation writers, include your professional headshot in the CV. Because what happened when you are including your headshot, you are kind of reminding them about you, about your work, and which things they admire about you. I think this is a great point to remember when you are giving CV to your LOR writers. Then letter of recommendations. I'm including all this because in the ERAS application, will come with personal statement, letter of recommendations. Always request early. So this year, I'm writing letters for the US graduates, and they asked me 5 months ago. I was so impressed, and then I was thinking, oh my God, I never even thought about it when I was in that stage. So very important point, request early. It is always better to write to see letters. So reach out to the letter writers whom you believe that they will write a great letter for you. If you feel that no, they will write a okay or so-so letter, that is not the right attending physician to write a letter of recommendation for you. Always upload updated letters. For example, if you are a candidate who applied last year, and if you are applying this year as well, please, if you are getting the letter from the same physician, tell them at least to change the date of the letter. They may keep it almost same, but date is very important. Updated letter goes a long way. Couple of other tips regarding letter of recommendation is that give your CV to the letter writers. And you know what I also asked to the candidates who asked the letter for me, that please include 5 to 7 key points or 5 to 7 achievements of your career. For example, if you did great in your medical school, if you got honor in your internal medicine clerkship, what are the highlights you want me to add? Put it in a small summary. Then, with all the respect to all the physicians who are practicing in Bangladesh, India, and countries other than US, it's always better to have letters from physicians who are practicing in the US, because you are applying for residency training in the US, and this is like very easy rule that when I am a US physician, I know that hospital that is said well, then maybe in other hospital in a different country. Have a good balance of clinical and research faculty. Maybe you are a great researcher. That's wonderful. However, remember, the residency for 3 to 4 years, depending on your specialty, this is mostly clinical. Particularly if you are applying for a community program, emphasize to have more letters from clinical faculty than the researcher. At least that will be my advice. And as being the interviewer for last 6 years and talking with multiple program directors, I found that they think in a similar way too, because truly interns, residents are doing clinical work than some of the research work. Couple of important points regarding personal statement. Do it within 1 page. I cannot emphasize enough. In the US, when you will be the resident, ultimately attending physician, you will know that truly how many things are on the plate of an attending physician. I know that many physicians, they are doing so many things, teaching, working, they have their family life too. So rule of thumb, keep it in 1 page. This is the perfect opportunity if there is any gap in your education, or if there is any red flag, for example, low score, failure. This is the great opportunity to explain that. Do not write it in ERAS application, because there is no formal grammar check, nothing in the ERAS application. So what I did personally, I wrote it in a Word document. After proofreading it multiple times, then I copy-paste it in the ERAS application. However, remember it, when you are copying paste, if there is any word missing, ERAS has no option to give you that signal. So proofread it after you copy-paste to the ERAS application. There will be a couple of documents you will need from your medical school. That is medical school performance evaluation, your medical school transcript. As we know that anything coming from another country or even in the US, it just takes time. So rule of thumb, request it early, because For me, for that to get that MSPE, it took a couple of months. Then ERAS application submission. Many people ask me that, okay, I do not have all the LOR or I'm waiting for some score. Should I wait and I can submit the application when all of them are done? You know, you can wait, but this is highly recommended that do it on first day, because first day is truly your last day of the submission, because many programs, they will upload all the application on the first day, and truly maybe later that they do not even bother to upload the applications because there are so many applications, they do not have to. So take it to your advantage, prepare it ahead and submit it on the first day. I cannot emphasize enough how important is that. Couple of important points I would like to highlight: that an outstanding ERAS application requires planning, time commitment, as well as dedication. As I highlighted earlier, this is not math, this is not science, truly. There is no right or wrong. However, there is always opportunity to do it better and make it outstanding than other candidates. Do not try it in a single attempt. There is no way you can do it. Particularly all these 4 changes, which I have highlighted earlier, it will take so much brainstorming that, okay, which points I should include, what are my meaningful experiences, what are my impactful experiences. It is not possible to do it in a single attempt. It truly takes a lot of time, revision, and time commitment. Valuable free resources. AAMC has CV templates, and truly they have all the description for all the new changes of ERAS application. And also I found that American College of Physicians medical student section, they have wonderful free resources. You do not have to be even member. So please take this opportunity to utilize these free resources to make your application outstanding. We are coming very close to end of this session. I would like to end this session with a couple of the key takeaways, hoping that you will be able to utilize it for your ERAS application. First, I cannot emphasize enough how important it is to gather clinical and research experiences, because otherwise you have to write those 10 experiences, it will be empty. Secondly, make sure to save the application before leaving. It happened to me when I was doing it on the first time. I did not know that, okay, I have to save it. Make sure you are saving it before exiting the application. Otherwise, no changes will be saved. Thirdly, use active verbs. We have talked about that, how active verbs can give power to your writing. I found that bullet points, keep it minimum. 3 to 5 points is always very easy to follow, always very easy for the reviewer to glance through. And revise. Revision is very important to make it flawless, that there is no mistakes. Even if simple mistakes can ruin your application. I will welcome your question, comments. I hope you found value in this talk. And thank you so much, BMNA, for inviting me. Now I'm happy to answer your questions. Thank you once again.
Thank you, Dr. Farzana. I really appreciate your time from your busy schedule. Thank you for this excellent discussion and your insight, which definitely helped our young physician. If anyone has any question, please ask Dr. Farzana. The floor is open for you. You can unmute yourself and you can ask question, please.
Hello, Dr. Farzana. My name is Dr. Pallav Sarkar, and I'll be applying this season. I wanted to know a bit, as you mentioned, there are only 10 experiences, right? Of which, how much should we allot for clinical, how much should we allot for research and volunteer? As perhaps should we allot 4 for clinical, 2 for research, or 2 for volunteer, or should we allot 2 for hobbies, or just 1 for hobbies, or something of that sort? The mixture is what I wanted to know.
A very good question. So the question from Dr. Sarkar is that among those 10 experiences, how many will be work, research, volunteer? So truly, there is no clean cutoff from either side that, okay, how many you should include clinical research. So two key points I would like to highlight that truly it depends upon that, okay, what are the most important experiences you have, or in other words, which experiences you want to highlight. That goes on the candidate side. Second point, as this residency is mostly clinical, I will still advise you to have a good balance of more little bit on the clinical side. Then if you have the research, include some research, maybe one or two, highest two will be volunteer. So rule of thumb, mostly should be clinical. And second, have some little variation with this clinical research and volunteer.
All right, thank you very much. I also want to know with regards to the IM cell, right? There is internal medicine structured evaluation letter. Is that still applicable in this season? And if so, should we get it from our medical college, the Sher-Bangla Medical College, or if we should get it from them, or is it advisable to get it from a US physician?
That truly depend upon that how many US physicians you have contact. So I can share with you my experience. So I know that most of the programs asked for 3. So I had 4 letters. I intentionally had 1 more. So 3 of them were from US physician and 1 I had from a physician from Canada because I worked in Canada.
Thank you very much.
So I see there is a hand raised from Dr. Akhtar. Dr. Akhtar, you can unmute yourself and please ask me.
Hello, Dr. Hawk. Thank you so much for this very informative session. I am Fahim Akhtar. I'm applying in internal medicine this year. So I have 2 questions. One is when I'm uploading, when I'm assigning LOR to the program, so would it be better if I mix match it like clinical experience, research, clinical and voluntary LOR, or I should just upload the clinical LOR? Which would be the better to do? And my second question is, you mentioned about signaling the program. So when is the best time to signal the program? After giving the interviews, when I rank the program, or when I just apply the program? When should I signal the program? And thank you so much.
Thank you, Dr. Akhtar. So there are 2 questions. First, Dr. Akhtar mentioned that, okay, how to mix match the letter of recommendations, either like clinical research. So truly, I believe that it depends upon the letters you have. For example, if you have a letter from research from Mayo Clinic, and you know that that's a big shot of Mayo Clinic. And if you have letter, maybe, from other clinical, so what I will do, I will customize that letter. For example, if I am applying to a program in the new year who are not very much heavy on the research, they mainly focus on clinical. So what I will do, I will streamline all those clinical letters to them and maybe add 1 research. In contrast, if you are applying to a big university program who have good research, and if you have 2 research letter, maybe I will give those more 2 research letter and add 1 clinical letter. So what I did when I was, in this place, I keep in mind that, okay, what they are truly thinking about me, or what is their expectation from the intern. And this way, I customized the letter to the program. And the second question Dr. Akhtar asked that, okay, when is the right time to give the signaling to the program? And the answer is when you are applying, when you are submitting that button, that's the right time. Because what happened last year, this section was under the supplemental ERAS. And they did the survey from a couple of program directors, and almost 50% program director, according to the AAMC survey, told that they choose or they send interview to the candidates according to the signaling. So for example, if you are interested to a New Year program, if you give them signal, they will know that, okay, this candidate is interested to our program. So that will increase your chance to get the interview in that program. So as soon as you are submitting, that is the time to give the signal to the program so that you can optimize the chance of your interview. And thank you for your kind words, Dr. Akhtar.
Thank you so much, Dr. Hawk. I appreciate it.
Likewise, thank you for joining us.
Prince, you can unmute yourself. Yeah.
Okay, thank you, Dr. Hawk, for such a good and informative session, and good afternoon, everyone. I'm Prince Shahriar, 2024 Internal Medicine Math applicant. So my question is regarding the all the 10 experiences. So I want to ask that which option will be more impactful? So if I add all 10 experiences based on my US work and volunteer, and option 2, I combine both Bangladesh and US experiences. And another question, does it have to start, any certain period, like it has to be from my high school or my intern period, or it can be from any time?
Okay. Thank you, Dr. Shahriar. First of all, for your kind words and joining us. So first question you asked about the 10 experiences, whether it should be like Bangladesh or from US. So my advice would be, if you have more US experience, I will emphasize that more, because they want somebody who is familiar with the US system, US culture, US how to talk, how to work with nurses. So if you have that experience, I will highlight that. In addition, if you have maybe, you were the medical officer, you saw 70 patients per day in the Bangladesh. So then I will highlight 1 or 2 of them to showcase that, okay, you can take pressure load. You have seen a lot of patients with limited resources. You have seen patients from poor financial, economical background. You have seen complicated cases. So rule of thumb, I will add more US experiences to add diversity, to add more dimension in your application. I will add 1 or 2 experiences from other countries. For example, I did it from the experience of Canada. And then second question you asked, remind me your second question one more time, please.
So it was, there is in any certain period I have to add, like, do I have to start from intern period, or, can I start from after the intern period when I work as a medical officer, or do I have to start, when I work, in US? So is there any time limit that I have to add?
Very good question. So Dr. Shahriar's question is, what is the time limit? Should it be from internship, after internship, or only in the US? I should say internship sounds very good. If you have, for example, as the medical internship in our back home, we saw a lot of patients, right? We manage truly almost everything. So I believe that's a great experience to highlight that, okay, how many patients you saw, what was the intensity. You should highlight the limited resource. That should be point. Second point is that I will be very cautious to bring any experience from high school. This is my personal opinion. That sounds very, very far. And truly high school is not giving that much signal that, okay, I was seeing patients, I was doing care. If it is very different, for example, you were the president of any medical organization or of any volunteer organization, under your leadership, you arrange a medical camp, you arrange blood donation camping, that is different. So if you want to bring any high school experience, that should be very, very significant. Otherwise, I will start from internship.
Thank you. Thank you so much.
You are welcome.
Okay, going to the next question. Before going to the next question, I think.
Hello, good afternoon. I'm Aditi Roy. So
Aditi,
I have one question.
Can you give us a minute?
Yeah, sure, sir. Sorry.
So before going to the next question, I will invite our immediate past young physician secretary, Anindita Ahmed. She is in round. She's here. Before going to see her next patient, she can speak with us. Anindita.
Okay, hey, Assalamu alaikum, everybody. And
Assalamu alaikum, Dr. Ahmed.
hey, Assalamu alaikum, Shormi. Let me call you by your nickname. It was a wonderful session as usual. I mean, so much information, and I wish I had such, presentation before when I applied back in 2007 or 8. I'm sure whoever attended the meeting, it has been beneficial for you, and this is the time you ask as many as questions you can. Because Shormi is a pro. Dr. Farzana Haq, she knows, she can explain you every detail of the ERAS application. We think that some of the few details or some of the details are not that important, but those can be eye catcher. I can guarantee you. So this is, I'm glad that lots of you were able to join, and Sakib, you did a wonderful job organizing this meeting. Thank you so much. And please feel free to reach any of us if you have any more questions after the session. Thank you so much.
Thank you, Anindita. Adiba, you want to say something?
Thank you, Dr. Ahmed.
Adiba?
Oh, I'm sorry. Thank you, Shormi. Thank you very much. As usual, Shormi is a resource. It's not just she's a research, she does research on what to do. We all know some sort of ERAS application, and we can tell you some sort of outline, what are the basics, how do you want to approach your LOR persons, how do you want to express yourself, but she really does the work of going through the website and the updates. So this lecture is very important for you, and I can't thank her enough, the amount of hard work she did in the background and gave us this time. However, there's few thing is, if you are applying, as I agree with Sharmi, no matter where you are, if you are complete on most of the things and you are sure that all grammatical things are right in your letters and your personal statement, please submit on the first day. Don't wait. The first day is the last day, I will say, with Sharmi, because that's the day they will open. They will reach out to you that your application is incomplete, or you can send that signal that I submitted, but I have to still submit this thing. Make sure that LORs are there. According to my previous work experience, the program directors that I worked with, they used to say that when they chose a candidate, definitely score, give them some place to differentiate who are they gonna sort out, because there was no other way that time. Now it's kind of mix and match about scores. So they look at the LOR. Who is describing you as a very good person fit for this job, who will work seriously? And it will come in different way. If you read many LORs every day, you will see who is passionate about somebody, expressing the right things, and who is barely writing things. So choose your LOR persons carefully, who can describe you the best. Otherwise, I can't, everything Sharmi says, I have to agree. And thank you very much. Good luck to everybody. We are here. And some of you have reached to me. Maybe, if we divide and work with you 3 to 4, 1-to-1, then that is helpful for all of us, so we don't overlap. So your time is also well spent. That's all my suggestion will be. So good luck to everybody. Thank you.
Thank you, Dr. Giti. You are too kind. Appreciate it.
Okay, I think we can go back to the question. Aditi, you can unmute yourself.
Hello, everyone. Good afternoon. I'm Aditi, and thank you, Dr. Hawk, for your wonderful presentation. So my question is regarding 3 most meaningful experience. So can I include my internship experience here, or I should include my recent US experience? This is my first question, and my second question is regarding my degree year. My final professional examination was on 2015, but my due certificate issued on 2017. So which year should I put there? Thank you.
Thank you, Dr. Roy. So thank you for asking these 2 insightful questions. First question Dr. Roy mentioned that in the 3 most meaningful experience, should she include the internship or only the US experience? Truly, first of all, I believe it depends that, okay, how many experiences you have. If you feel that, okay, no, you have 3 excellent experiences from US and now, you were struggling, okay, which one to choose, I should say that, okay, go with 3 US experiences. However, I believe that as an intern in our back home, we have done great work. Truly, we took the ownership of the patient and we have accomplished a lot of skills. And if you believe that, okay, no, this should be one of your 3, I think this is also a good option. So truly, it depends upon how many other experiences you have. If you have a lot of other great US experiences, maybe put the internship, one of them, on the 10. However, maybe if you have 2 good US experience, and the third could be easily the experience from our internship. And the second question, Dr. Roy mentioned that what could be the year of graduation date? I think, sometimes this is dilemma. So you are not only alone. I know that many of the international medical graduate has these questions too. So I talked with a couple of the, program directors, mentors. To my research, the date in your diploma should be the date of year of graduation. So that is my finding after talking with a lot of people. Thank you.
Thank you, Dr. Hawk.
You are welcome, Dr. Roy.
I think we'll take one more question. If anyone has any question, you can unmute yourself.
Hello, thank you, Dr. Farzana, for the great presentation. So I'm currently in a department at a university hospital in the US. So my question was, since there's no time for attending or publishing a paper, can we do oral presentation at the grand rounds and say that and put that as a presentation? Will that work? Is that acceptable?
Okay, very good question. So Dr. Arham has the question that, okay, as there is not that much time for publication, which is, truly I can understand. Can the oral presentation, like grand round presentation, could be included as oral presentation? Absolutely, yes, because, grand round presentation truly carries so much weight compared to poster presentation. So if you have any oral presentation in any conferences, it could be either national, international, regional, grand rounds. This is a great opportunity to showcase that, okay, you have done this oral presentation. Thank you.
Thank you.
Assalamu alaikum, Sakif. This is Aisha Sikdar. Can I make a comment?
Yes, sir. Ashapa, please.
Thank you. Thank you, Dr. Farzana. তোমার কথা আসলে আমি শুনছিলাম, এত fluent delivery, এত well organized. I hope the participants took lots of notes. একেবারে মনের থেকে কথা বলছিলে, যেটা insight information. I think this will be so helpful. If I was an ERAS application, I was in the pool, I would already gain tremendous amount of confidence just by listening to you. I think we are lucky to have you as a speaker, and I think Bimana is really enriched to have speakers like you, Farzana. I'm looking forward to hear from you in the future. And thank you, Sakif. Very well done. Thank you, everyone.
Thank you, Dr. Shikdar. You were too kind, and congratulations on your winning. So well deserved.
Thank you, Apu. Thank you. Coming from you, it means a lot.
Thank you, Ashapa. Mount Haya, should we conclude the session?
I saw one more hand, right? Saira?
Yes. Assalamu alaikum. Yes, sir. I did raise my hand, but as soon as sir said that they'll be taking their last question, I thought that it was, I couldn't ask my question. But thank you so much, sir, for giving me the floor. Assalamu alaikum, everyone. My name is Dr. Sayara Sheikh Shama. I would like to thank Dr. Farzana Hawk for such a tremendous presentation. And I cannot agree more with Sigdar ma'am that it was so dynamic and so insightful that I kept taking notes and notes and notes. So thank you so much, ma'am, for sharing such insightful information with us. The question that I'm about to ask, in order for me to ask that, I need to give you a little bit insight about myself. I was always very passionate into becoming a doctor. So right after finishing my high school, I joined an NGO in Bangladesh that's confidential approach to AIDS prevention and worked as a volunteer for a couple of months before I got into med school. So I know you mentioned in the presentation that in the list of 10 experiences, it's preferred not to start from high school. But I learned a lot of things from that experience of mine, where I went to slums of Dhaka and educated them about HIV and AIDS prevention. So if I want to include that in my ERAS application, what are your thoughts, and which section would you prefer for me to include that? Thank you.
Thank you so much, Dr. Sharma. First of all, your kind words. So Dr. Sharma's question is that she has an excellent, very insightful volunteer experience in her high school. So should she include that experience? So the answer has twofold. First, it depends upon how many other US or other clinical experiences you have. You know, when I first time applied for the residency, as gaining the experience here, it's not easy. So if you have limited, I believe that's a great option to highlight in your experience. If you have so many experiences, US experiences, research experiences, and you are, struggling, okay, whether should I add it or not, I believe that's a wonderful story to add to your personal statement. And, it could be one of the attention bringing hook in your personal statement that, okay, how your experience in this NGO make you familiar with the underprivileged population, how you name from the populations who have lot of limited resources. Even if you do not have option to include it in your experiences section, you can easily add it to the personal experiences. And if you feel that, okay, no, I have some options for US experiences and some from other countries, and I want to add these experiences, then add it under the volunteer, and maybe this should be your only volunteer experience. And I will also recommend you to add it to your personal statement as well, maybe even one line. I found it very much insightful that, okay, you have worked with these HIV patients, and I believe that's a great information to add to your personal statement as well. Thank you.
Thank you so much, ma'am.
You are welcome.
Dr. Farzana, should we take any more question if it's okay with you? One more maybe?
This is up to you and up to Dr. Mamun.
If you are comfortable, we are okay.
We can ask our president, Dr. Shikdar.
It's okay, right? I think Tamina, can you open up your mouth, speaker?
Assalamu alaikum everybody. আমার একটা ছোট প্রশ্ন আছে। আমি সরি, আমি কিছু পার্ট মিস করেছি, হয়তো ওই প্রশ্নটা আনসার আমি শিওর না আসলে কেউ পোস্ট করে ফেলছে কিনা। তো ইরাজে এবার আমি সেকেন্ড টাইম অ্যাপ্লিকেন্ট ফর দিস ইয়ার। তো ইরাজ অ্যাপ্লিকেশনে এবার আমাদেরকে আমরা ইচ্ছা মতো এক্সপিরিয়েন্স দিতে পারবো না, 10টা মিনিংফুল এক্সপিরিয়েন্স ইনক্লুড করতে বলেছে। তার মানে কি গ্যাপ ইয়ারটা আমাদের থাকলে সমস্যা হবে না? কারণ সাকসেসিভ 10 এক্সপিরিয়েন্স তো আমার জন্য মিনিংফুল না। তো আমি একটা এক্সপিরিয়েন্স হয়তো আমি 2020-তে, আরেকটা মিনিংফুল হয়তো আমার 2022-তে হবে। এর মাঝখানে যে একটা গ্যাপ থাকবে, ওটা কি আমি কিভাবে এক্সপ্লেইন করবো ওটা?
Very good question, Dr. Firdaus. So Dr. Firdaus' question is, okay, will these 10 experiences need to be in consecutive years? So the answer is no, absolutely no. They are asking for your 10 prominent, very important selected experiences. So it could be from 2020, one from 2023. So you can add it and it will be perfectly fine.
আপু, তাহলে এটা কি আমাদের জন্য একটা প্রিভিলেজ যে শুধু 10 মিনিংফুল এক্সপেরিয়েন্সটা লিখতে বলা হয়েছে? মানে আগে আমাদের যে সমস্যাটা হতো, আমার গত বছর যে প্রবলেমটা ছিল, আমার একটা গ্যাপ ইয়ার আছে, যে আমি আমার একটা লং গ্যাপ ইয়ার থাকতো, কারণ আমি কনজিকিউটিভ এক্সপিরিয়েন্স আমি দেখাতে হতো যে আমি একটা হয়তো 2015-এ আমি ইন্টার্নশিপ শেষ করেছি, এরপর আমি আবার স্টার্ট করেছি 2018-এ, লং গ্যাপ ইয়ারটা থাকতো। কিন্তু এখন আমার ওই গ্যাপ ইয়ারটা হয়তো আমাকে মেনশন করতে হবে না। এটা কি তাহলে আমার জন্য একটা প্রিভিলেজ হিসেবে আসবে, নাকি অন্যভাবে আসলে ওরা বুঝে নেবে ওনারা যে আসলে আমার একটা গ্যাপ ইয়ার আছে? এখন ওনারা কিভাবে বুঝবে আমার যে কত বড় মানে আমার কয়টা গ্যাপ ইয়ার আছে, ওনারা কিভাবে বুঝবে এখন?
ভেরি গুড পয়েন্ট। আমি পার্সোনালি মনে করি এটা আসলে ভেরি গুড পার্ট। মানে ইরাস এটা খুবই ভালো একটা ডিসিশন নিছে, কারণ আগে কম্পিটিশন, কে 20টা না 30টা না 40টা এক্সপিরিয়েন্স, কিন্তু এখন 10টা সিলেক্টেড এক্সপিরিয়েন্স। দ্যাট মিনস আপনি আপনার পছন্দ মতো যেটা সবচেয়ে ভালো সেটা দিতে পারবেন, এবং গ্যাপ এখানে কোনো ব্যাপার না। সো আই ট্রুলি বিলিভ দিস ইজ আ ভেরি থটফুল ডিসিশন from ERAS, and I know that that was also echoed by the US graduates as well. And truly, some gaps can happen because even for US students, they can take gap for volunteer, for some mission work, and life happens. So if there is any gap, if there is significant gap, that's always advisable to explain it in the personal statement. However, in terms of these 10 experiences, this should not be an issue.
Thank you. Thanks a lot.
You are welcome.
Okay. So Sakib, before your concluding remarks, I just want to take 1 minute. Thank you, Farjana. It's as every year, and it's all the time. I know that you are very well known in this sector, and not only among Bangladeshis, all over USA. All program, not all, many program director knows that you are a very well known speaker on this. So thank you for your achievement, for your hard work, and for your research. I hope you'll be always helping us. And a couple of things I want to mention, as Farjana said, there's some effective point, active point, efficient point, right? So whenever you are doing in the volunteership, observership in the hospital, what my observation is, you're always emphasis is on you are putting importance on only the case presentation. Only you want to be a part of the academic discussion with the resident or student, or sometimes I see that I finish my round and you finish your round also, you leave the hospital. That's Farjana said, that even the case presentation won't be a you cannot make it as a efficient case presentation or research thing. This is our everyday work. But for you, as Farjana mentioned, you should take some opportunity. If you are inside the hospital or the clinic, take the opportunity to help the resident for their other work, like calling the patient, helping the patient to transport to the radiology department, or have some blood work, or you can do some work with the physical therapist, social worker, okay, and call the patient, have some information, and deliver this information to the resident, and you can write it in your CV. So these all are, is the resident are working the whole day, and sometimes you go there, you stay in the hospital only for an hour or two, and you are basically missing those things. Your academic portion is already tested in the exam, but how much you can be compatible with the US system, that's the portion you'll be reflecting, that will be reflecting in your observership, your externship, or your volunteer work. That's the only little portion I want to add. But besides Farjana's explanation, nothing you can miss. So you can go through that and all will be answered. Thank you.
Thank you, Dr. Mamun. I truly appreciate the opportunity to speak to our wonderful, brilliant, aspiring physicians. I cannot appreciate your leadership enough.
Thank you.
Dr. Farzana, thank you so much. Actually, I personally also follow you on the Facebook, and I see all of the videos, and here all the participants, I want to tell that if you want to see all other videos of Dr. Farzana, you can go to her Facebook page, and then you can see all of her other videos, how to stand out during the residency, and other videos, how to do the interview session. So she has excellent videos there. Please follow those videos there. And then I'd like to take this opportunity also to thank our BMNA, President Dr. Bashir, President-elect Dr. Aisha Shikdar, our General Secretary Dr. Mamun, and all the participants, all the BMNA members, and all the past presidents to give us this platform for discussion. We will continue to this session for the residency applicants, especially targeting this residency application season now. Our next session also will announce in our Facebook page and also in the WhatsApp. Please keep following the page, and then we'll upload our next session. Thank you again. If you have any other thing, Dr. Mamoun, should we conclude?